This is Dr. Shakil Ahmed. On behalf of Shakil Health Society YouTube channel, today I will present fatty liver. Hepatic steatosis is defined as fatty loading of the liver. The most important cause is chronic alcohol intake. It is also called alcoholic steatohepatitis ASH syndrome. The second cause is obesity, the diabetes, dyslipidemia, which is also called non-alcoholic steatohepatitis syndrome. And another cause is chronic hepatitis C. In approximately 50% of hepatitis C patients, mild fatty loading is present. It was believed that hepatic steatosis is always diffuse. But after emerging of new diagnostic modalities such as high-resolution ultrasounds and CT scans, now it is revealed out that the hepatic steatosis can affect the liver unequally, and therefore fatty-free areas can be seen within a fatty liver, or focal fatty infiltration can be appreciated in a normal liver. The reason for this different fat load is not clear. It is likely due to the changes in the arterial porto-venous vasculature, well-vascularized areas being less fatty. Hepatic steatosis can be simple, which is asymptomatic, while it can be associated with inflammation manifested as cytolysis syndrome or steatohepatitis. Ultrasound cannot differentiate these two types. The cytolysis syndrome should always be evaluated with the GOT and GPT ratio, and there will be increased GOT GPT ratio, and that will indicate alcoholic etiology. The presence of the HCV antibodies shows association of liver steatosis with chronic hepatitis C. Ultrasound is the modality of choice which can easily and precisely diagnose the hepatic steatosis. The sensitivity is more than 90%. The liver appears hyperechoic as it is compared to the renal parenchyma. It is accompanied by posterior attenuation due to this fatty tissue. There is direct correlation between the liver fat load and the severity of the posterior attenuation. Therefore, depending on the intensity of posterior attenuation, a subjective and semi-quantitative assessment of the steatosis can be made. Attention is required that severe steatosis may obscure deep lesions of the liver. Therefore, further modalities such as CT scans are recommended in such cases. Regarding grading, score 0 is for absent fatty changes or liver steatosis. Mild steatosis, the score is 1, that is slight diffuse and increase in liver echogenicity, and normal diaphragm and portal vein wall is appreciated. Moderate, the score is 2. It shows increased liver echogenicity with slight impaired appearance of the portal vein wall and diaphragm. While the severe, the score is 3. There is increased liver echogenicity with poor or non-visualization of the portal vein wall, and diaphragm. And the posterior part of the right liver will not be clearly visualized. These two images show mild hepatic steatosis. In this, we can see that the liver is hyperechoic, but the vessels wall can be appreciated, and also the diaphragm is appreciable. In this image, the diaphragm is poorly appreciable and the liver is hyperechoic. This is a severe case. We cannot appreciate the wall of the portal veins, and also the diaphragm is not appreciated in this, therefore labeled as severe hepatic steatosis. There is another term used, focal steatosis or fatty free areas. Ultrasound shows the juxtaposition of the liver tissue with different echogenicity. Free fatty areas are hypoechoic areas in a hyperechoic liver, while focal steatosis are hyperechoic areas in a liver with normal echogenicity. So, the focal steatosis in the fatty free areas are present. The delimitation of these areas is clear. They have often a geographical contour and variable size. They never alter the hepatic surface or infiltrate and invade vascular structure. In these two images, we can see that fatty free area is present in the right lobe, while there is a fatty free area in the left lobe. This is the focal steatosis surrounding the GB. This is the GB, and these are the hyperechoic tissue. So the GB or the gallbladder is surrounded by the fatty steatosis. The differential diagnosis of fatty free areas is difficult. So we should exclude the primitive or secondary liver tumors that can appear in fatty liver. DD cannot be done only by standard ultrasound. Contrast imaging methods are necessary, such as CT, MR, and contrast enhanced ultrasound. If we conclude, ultrasound is a good method for assessment of the hepatic steatosis because ultrasound is non-invasive, used for semi-quantification of steatosis, and this is well correlated with the histological fat loading of the liver. Ultrasound easily diagnoses the focal hepatic steatosis or fatty free areas, while differential diagnosis will require expert sonologists and sometimes needs contrast enhanced ultrasound. Thank you very much for watching.